Hello, and good evening once again. Dr. Aladade here at Ask the Gynecologist, and tonight I'll be talking about polycystic ovarian syndrome. I hope you're free and you're able to join me so we can have this talk together. Polycystic ovarian syndrome. Welcome once again, Dr. Aladade here at Ask the Gynecologist. I'm hoping my audio is good. If my audio is not good, let me know so I can change things or improve the audio and to make things better. But most importantly, I want to say good evening to everyone. My name is Dr. Lalade, and I'm so happy to be here. And most importantly, I thank you everyone as well for finding time to join us tonight. I know it's a bit late. Over here in the UK, our time is about 8 something, 8 o'clock or so, and in Nigeria it will be about +1. So most importantly, I want to say thank you for spending part of your time and data to listen to me tonight. Today, I'll be talking about polycystic ovarian syndrome. Polycystic ovarian syndrome. So if you're free, please pay attention to this discussion so that you don't miss anything, nothing from this discussion. If you have friends that are supposed to be here, go and remind them that it's time, we're about to start. And I'll be talking about polycystic ovarian syndrome, how it affects infertility, how you can treat them effectively and overcome them. So this is Ask the Gynecologist, and what we do here on Facebook is we use social media to pass across consistent healthcare information pertaining especially to the women. And it's not just for women alone. Men too can learn tremendously many things here on ATG. ATG stands for Ask the Gynecologist. I'm a doctor by profession, and I've been doing gynecology since 2004. And I want to say thank God for everything. It's been a long journey with ups and downs. I must tell you, really ups and really downs. And most importantly, I want to say I'm grateful to God. I'm a graduate of University of Lagos. I finished medical school in 2002, and you know, it's wonderful. ATG prides itself, by the grace of God, through you all, a laboratory in Lagos where we run infertility tests, and also we have an IVF center in Lagos as well. And as I promised you, by the grace of God, God willing, and God's grace behind us, we'll be able to move our ATG IVF center and open a branch in Lekki soon, by the grace of God, if God says so. I want to say it's been wonderful because everything we do here is for a service to provide value, to produce value for people like you listening to us, and for women in the diaspora all over the world that are waiting for expectation and answers to their prayers. PCOS. So what is PCOS? Well, PCOS means polycystic ovarian syndrome. PCOS is not the same thing as ovarian cyst. Please get it right. PCOS, polycystic ovarian syndrome, is not the same thing as ovarian cyst. They are two different things. Hello, Miss Lizzie. Thank you so much for joining. Miss Lizzie, she's one of our promoters of ATG. She's one of our pictorial models on ATG, and she's doing amazing things on Ask the Gynecologist. Thank you, Miss Lizzie, for joining us tonight. And Cecilia Ibimilua, and my boss, Dr. Declan Quinn, thank you so much, sir, for joining tonight. So like I was saying earlier, PCOS is totally different from ovarian cyst. I'm going to use my whiteboard here to explain what I'm trying to say. So if you look at this model where you see the ovaries and the womb in the center, the ovaries will look like this. Okay, that's the ovary. Okay, on one side, left and right. Ovarian cyst is a separate entity like that. It can be filled with fluid, a simple cyst. It can be filled with blood, hemorrhagic cyst, or it could be a complex cyst that contains many stuff there. So it could be filled with fluid, simple cyst. It could be filled with blood, hemorrhagic cyst. Sometimes it could be filled with many stuff which are totally confusing. Ovarian cyst is a separate thing attached to your ovaries. Okay? But now I want to talk about polycystic ovaries and polycystic ovarian syndrome. Now, this is ovary. When we talk about polycystic ovarian syndrome, this is your ovary. When you cut the ovary open, you see tiny follicles within the ovary. Ovarian cyst is a separate cyst outside the ovary, but polycystic ovaries, okay, is a description where you see tiny cysts within the ovary. I hope people can see me from Instagram here. So this is ovarian cyst. That's the ovary. And you see a separate cyst. That's the ovarian cyst. Polycystic ovaries, you see the ovary, you slice it open, you see tiny cysts like that, okay? Those follicles you see within the polycystic ovaries, okay, is described as basically polycystic ovaries, okay? If your polycystic ovaries is not causing trouble, affecting the way you produce hormones, especially your LH and FSH hormone, causing that disparity, is a disparity we'll watch out for. If your polycystic ovaries is causing those things, okay, and also causing what we call scanty period, oligomenorrhea, or making your periods irregular, it becomes polycystic ovarian syndrome. Polycystic ovaries is slightly different from polycystic ovarian syndrome. Polycystic ovaries is just a way to describe what we see within the ovaries. Some people do have polycystic ovaries and they don't have problem getting pregnant. Some people do have polycystic ovaries and they don't have infertility issue. In fact, a lot of people that have polycystic ovaries, okay, can be thin as well. I've seen people that are of normal BMI, they have polycystic ovaries. I've seen people that they are so big, okay, just excuse me for using that word, and they do have polycystic ovaries and they get pregnant. So having polycystic ovaries does not automatically make you not to get pregnant. Polycystic ovaries is a descriptive term, okay? You have those follicles arranged outside your ovary like that. Those follicles don't release egg. They are like, basically, they don't release egg. You know, when you eat egg at home, you cook in the kitchen, those eggs you eat at home to cook or to fry your eggs or to do your scrambled eggs, they are eggs that don't hatch, okay? The same thing we have here, these eggs and this kind of ovary, polycystic ovaries, don't hatch. They don't hatch, okay? And that person will have excessively high LH in their system, and those eggs don't hatch. Because those eggs don't hatch, they can't become pregnant. People that have polycystic ovaries, if they have scanty period and abnormal hormones, especially the LH hormone, we now say they have polycystic ovarian syndrome because it comes with the package. Polycystic ovaries is just one of the things that make it polycystic ovarian syndrome. Am I making sense? So for you to have polycystic ovarian syndrome, you got to have polycystic ovaries, changes in your hormone, especially your LH hormone, is so high, and also you have scanty period. All these things will now make you not to get pregnant. That is polycystic ovarian syndrome. But polycystic ovaries itself is just a descriptive term. Because you are short doesn't mean you can't jump. Because you can jump doesn't mean you can put a ball in the basketball. Now, if you look at what I'm saying now, PCOS, polycystic ovaries, does not cause pain. But ovarian cyst, the first one, can twist on itself and it can cause pain. So when people come to me, they say, Doctor, I have PCOS, I'm in pain. PCOS does not cause pain. Polycystic ovaries can cause pain because this cyst can twist on the ovary and it can cause excruciating pain. That is why if you come to the hospital, pain is so severe, especially on one side of your tummy, we do a scan, we see a cyst on your ovary, we know you got polycystic ovaries, we deal with it. And we have ovarian cysts, we deal with it. Ovarian cysts can be very confusing too. The reason is that ovarian cyst itself, okay, if it's bigger than 4 centimeters, in most cases it will cause pain and we think of removing them. But in most cases, most cysts we see on the ovaries, ovarian cysts, less than 4 centimeters, they will probably disappear on their own. Usually within 2 or 3, 4 months, they will disappear on their own. So if I see a cyst, it's not causing pain, I don't panic. I don't start running to theater because in most cases, that cyst will disappear on its own. If someone has polycystic ovarian syndrome, polycystic ovaries, becoming polycystic ovarian syndrome, not able to get pregnant, okay, there are ways we can make them ovulate. And that is by using Clomid or Letrozole, Femara. I'll be talking about that this weekend, Sunday, 9 p.m. on ATG group to talk about how Letrozole and Clomid works. Letrozole, Clomid, they can help people that have polycystic ovarian syndrome to ovulate. But before we get to that point, it's not your particular food that you eat that makes you have PCOS. it's not because you consume a particular food or diet that makes you prone or develop polycystic ovarian syndrome or PCOS. No. Some people just have them. But what I know is that if you have polycystic ovarian syndrome, in most cases, and you start a strict exercise regime, losing at least 4 to 5 kilograms of body weight, in most cases, you're able to ovulate and get pregnant on your own. By losing weight, you say, but doctor, I'm not overweight now. I know, yes, most people listen to me are not overweight, but it's true. The fact is that if you lose some weight with such case, if you have polycystic ovarian syndrome, it will make you ovulate and get pregnant naturally. Worst case scenario, if it's not working for you, you can go as far as doing operation, what we call ovarian joining, where we put it to sleep through laparoscopy. We put a camera through your belly button. We can go and destroy all those tiny follicles on your ovary that can make you to ovulate. If we do that, it's not helping, or if we can't do that because of many reasons, we can proceed and consider giving you Clomid and do follicular tracking. Before we give Clomid to anybody, we go through your risk factor profile, ensuring that you're not at risk of having ovarian hyperstimulation, because Clomid Femara has a risk of causing what we call hyperstimulation syndrome, where the ovary overresponds and it can cause severe pain, severe kidney failure, can affect kidneys. So before we give you Clomid or letrozole, we do basic tests to check, we go through your history to see whether you are at high risk of having problems or complications from excessive side effect of the medication. So basically, that's what we do. Now, for us to give Clomid, we start with the lowest dose in most cases, 50 milligrams, and we can increase in subsequent cycles if it's not working. But if you've tried Clomid, it's not working, and you're having regular sex, we have to now start considering IVF in very rare circumstances if Clomid is not working. But before you reach that point, we must do follicular tracking to see how your body is responding to Clomid or letrozole, Femara. Okay? Now, what does letrozole do? What does Femara do? Those things help to increase health development and ovulation, and increases the chances of ovulation, giving people that have PCOS or not ovulating possible chance to grow and get pregnant on their own. But it's not for everyone. So that is why before you get Clomid, see a doctor, not just any doctor that is gynecologist, specialist gynae, so that they can go through your history, assess you, and ensure that you're not at increased risk of having those side effects from Clomid or Femara before they give it to you. So there are a lot of things we go through: your weight, whether you've used it before, whether it's responded before, what other medication you're taking. We go through all these risk factors to know whether you're at high risk of having severe reactions to Clomid or Femara. I know definitely that reaction to Clomid or Femara is not very common, but it can be very severe, and you don't want to see one to have to be guided. You need to understand that Clomid and Femara or letrozole can be sometimes dangerous to the body, so it should be given under controlled conditions. Follow up for follicular tracking scan to ensure that you don't overreact to these two medications, whichever one you're given. Now, some people ask, okay, doctor, is there any way I can take both together? You don't take both together. People are very smart. They want to be very smart. Yeah, I understand that. It's not your fault. But you can't take Clomid and Femara together. It's either you take one and you're under follicular tracking to ensure that you're not over-responding, or you don't take it at all. Don't go and start gulping the two together. You will knock down your liver and kidneys and you enter into problem much more than I'm trying to get pregnant. So a word is enough for the wise. Now, I can talk on and 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 talk on and on. But I want to give room for questions now before I continue on the other part of this discussion. So I'll give room now for questions. There's a question here on Instagram. Doctor, please, can one with follicular phase of 1.9 to 12.5 mid-cycle? Honestly, I don't understand what you're saying. Worry girl, New York. I don't get what you're saying here at all. I don't get it. Pretty precious. How are you, Vivian Dico Briggs, Christina Idowa, Emir Kamu? Doctor, I have this sharp pain below my abdomen once in a while, and if I don't eat early, is that something to worry about? If you're having pain and that pain is associated with when you consume food, or if you're not eating food, is likely to be an ulcer. You need to see a surgeon to examine you to check if you have ulcer, and if you have ulcer, they formulate a treatment plan to treat your ulcer as soon as possible. Ulcer not treated can cause more and dangerous things in your body. Okay, good. And now we've opened the floor for questions there on ATGO. So if you have questions, it's time for you to ask your questions. And thank you everyone again for joining today. Cecilia Ibimilua and Vivian Dico Briggs and Chidima Oji. And Chidima, thank you so much. We are also on YouTube. You can watch all my videos on YouTube. They are there arranged sequentially so that you don't miss any item, anything from my discussions. So my name is Dr. Babajide Alalade, one of your admins here at Ask the Gynecologist. It's my pleasure to be your host today. There's a question here on Instagram, Nimi B. You're having sharp pain below your abdomen. So you need to check whether you have your own infection, check whether it's appendicitis, check whether you have ovarian cysts by doing your scan, pelvic scan, check whether you have infection like PID by doing vaginal swabs to check for obvious infections that could be causing such pain. Okay, Osanyamwe Osamide and Chidima Oji, Christina Idowu, and there's a lady here, I love her name, Lalemi Vetu Izoje. Thank you so much, Lalemi. Thank you so much. God bless you, my sister. Doctor, please, can several DNC cause infertility in a woman? Yes. If you have multiple DNCs, you put yourself at risks of infection, PID that can cause damage or blockage to your tubes. By doing multiple DNCs evacuation, you put yourself at risk of forming scar tissue, Asherman syndrome, which could obliterate or block your uterine cavity and increase the risk of infertility. So, yes, multiple DNC, having abortions, repeated surgical evacuation, without mercy, can lead to such complications. And in fact, there's a risk that the doctor, by doing repeated DNC, can damage your cervix, making your cervix incompetent or damaged or sometimes, weakened. So doctor, can one really be diagnosed with PCOS even when she has a regular period? In most cases, if you have a regular period, you're unlikely to have PCOS. But I've seen people that have regular period, they got PCOS. But it's unlikely, very, very rare, for someone that has regular period to have PCOS. Can someone get pregnant with no signs? Yes, you can get pregnant with no signs. So if you've missed your period, the first thing you gotta do is to do urine test of pregnancy to see if you're pregnant or not. Can someone with PCOS have continuous miscarriage? PCOS does not cause miscarriage. PCOS might delay or cause infertility or delay you getting pregnant, but PCOS is not a cause of miscarriage. PCOS does not cause miscarriage. So far I know. I may be wrong, correct me. Does it mean if ovarian cyst is hemorrhagic, how can it be cured? In most cases, like I said, most cysts on the ovary, they disappear on their own. It's only in rare circumstances, if the cyst does not disappear, or is getting bigger, or is causing pain, or is causing damage to your tubes, do we go in to take it out through surgery. But if the cyst is there, it's not causing you pain, what we usually do is to repeat your scan in about 2 or 3 months down the line, and in most cases, it will disappear and go on its own. Hemorrhagic cysts will disappear and grow on its own. The ATG IVF Center is still running our promotional service for December. So if you can call the office tomorrow, call Nike or speak to Chioma tomorrow morning. Chioma or Nike, my secretary, should get you enrolled into the program so that you don't lose the bonanza that is on now till January 15th. January 15th, come January 15th, we will roll back to a usual price. So you don't want to lose that opportunity to get it. What you just need to do is to pay. Once you've paid, you put your deposit down, you are keyed into the program, even if you do your IVF itself after January 15th. So if you want to take advantage, yeah. If you want to say, okay, fine. I know a lady, she wants to do her IVF in February. What she did is she just paid about some deposit and she secured her spot. She will get a discount price whenever she's ready. So why do you have to wait until the promo is over before you pay? If the promo is over, you're going to go back to the old price. But if you key in now, you key into it with a small deposit, you key your spot, you don't have to pay the full price. So that get us apply common sense. The promo is on to January 15. You pay the deposit, you secure your low price entry, you come in February, you're sorted. Common sense, good. Why don't we take advantage of this now? And there's a question here on Instagram. Doctor, Do you have a center in America? I don't. We don't. Our center is in Lagos. It's on Lagos mainland. Are you in Abuja? No. Our office is in Lagos, but we are here online to advise. But our physical office is in Abuja. I'm in London, but our office, I run them from here. Okay. There's a question here, and I saw a question on Facebook. Letrozole, Clomid did not work for you. What else should you do? IVF. Or have regular sex and use pre-seed whenever you're having regular sex. But even if it's not happening, you've done this for so long, for more than 2 years, then let's think of IVF as a case of unknown cause of infertility. Like I said again, our office, our branch is only in Lagos now. Okay? People coming from America, from London, from Italy to Lagos to go and get the IVF done at our office. So we don't have office in Asaba, Abuja, or Kaduna. It's in Lagos. Lagos. Lima Alpha Golf Oscar Sugar. Okay, Sierra. That is it. Go there. We're waiting for you. God bless you. Can pre-seed lubricant be used? Yes, you can use pre-seed lubricant. Doctor, is it normal to feel vibration in the stomach about 3 months after pregnancy? I don't know what this is. So go and do a scan. And let's check your womb. Get a scan. Our office is in Lagos. It's in Lagos. So for about the promo, we can't talk about promo here. We are focusing on medical talk here. About promo details, just call our office, okay? You're getting a discount of 20% if you pay tomorrow, okay? It runs till January 15, okay? Why? IVF promo is 850, okay? Naira. Okay? Thank you, Deborah Simande Ochava. Good. So if you're in America, you can fly to Lagos to get it done. People are coming in from America. Two couples came from America recently. So and they are going back with their pregnancy. A guy is in America, but the wife is in Nigeria. He came in and left 2 weeks ago. The wife is pregnant now. I won't mention the name. If she's here, she knows me and she knows herself. Can I get pregnant while on period? No. Theoretically, if you're having a period, you can't get pregnant on a period. But you can get pregnant if you have sex a day or two after your period stops. But theoretically, if you're having a period, you can't get pregnant on your period. Anyway, can pre-seed be used to while on Clomid? Why not? You can use a pre-seed while on Clomid. You can use pre-seed while on Clomid. But while you're on Clomid, you can't have sex while you're on Clomid. Okay? You stop Clomid after day 5. You do follicular tracking on day 9 and 10. So you won't be taking Clomid at day 9 and 10 doing your follicular tracking. But you can use pre-seed with your sex anyway. What causes thickened endometriosis? Can someone get pregnant with it? Yes, you can get pregnant with endometriosis. But if your endometriosis is damaged your tubes and it's blocked your tubes on both sides, then you can't get pregnant with it. But if your endometriosis is not disturbing your tube, it hasn't blocked your tube or damaged your tube on both sides, you can get pregnant with it. Doctor, please, I don't know why my ovulation does not menstruate something. I don't know what you type. I don't know what you type there. It's Greek to me. Please put it in plain English. Please. Is it necessary to get genetic testing during IVF? It's not necessary. It's up to you. You don't have to do genetic testing during IVF, or it's up to you. If you want it, we can do it for you, but it comes at extra cost. It's not cheap. But you don't have to do genetic testing during IVF. But if you want and insist you want to do it, then discuss that with our office and they'll get that done for you. Doctor, I have PCOS. I was given metformin by my doctor. How can I ovulate? So if you're given metformin, they will tell you to keep an eye on your blood sugar level. They'll tell you when to use the metformin. And yes, if you use it, if you have diabetes itself, and you're prone to diabetes, and they are treating your diabetes with metformin, you can use it to get pregnant. Your friend's sister of 14 years old always menstruates more than 4 days every month. What's the problem? She's normal. In the first few years of someone's menstrual life, the period will be irregular. And also, towards the end of your menstrual life, your period too will be irregular. That is why I always mention this here. If you see a lady, if you see a young girl, 14 years old, she's never had periods before. Suddenly, at around 13, 14, a period starts to happen. For the first 2 to 3 years, the period will be irregular. The period is irregular, up and down. Suddenly, it becomes regular. Okay? And after a while, towards the end of age 40, 50, 51, 52, it starts to become irregular again, and it stops. This phase is called perimenopausal phase. Before menopause, perimenopause. This phase is just where a woman has irregular bleeding, okay? They are very similar. hormonal imbalance, natural for the body. During this phase, you're having your babies. Most people, 80% of girls, they have regular period and they're having babies. So it's common. It can happen. Don't start disturbing the girl or abusing the girl. Let it get settled into her life properly, okay? Can one get pregnant after taking Impregnil? I don't know what Impregnil is in Nigeria. Okay? I don't know what Impregnil, except I Google it. I don't, because the names of medications in Nigeria are quite different from what we use here. They're all the same content, but sometimes they have different names. Okay, doctor, can someone with PCOS get pregnant? Yes, someone with PCOS can get pregnant. If your PCOS is affecting your hormonal imbalance, then it can affect you from getting pregnant. If your PCOS is affecting your hormonal imbalance, then it can stop you from getting pregnant. But you can get pregnant even if you have PCOS. Left adnexa is cystic mass measuring 3 cm by 4.5 cm ovarian cyst. The right is free. Worried? No, don't be worried. Just repeat another scan in about 3-4 months down the line. In most cases, this cyst will disappear. What happened when ovarian cyst is hemorrhagic? Nothing. Sometimes, you see, when you ovulate, you release egg from a particular part of your ovary. That spot you ovulated from can sometimes be filled with small blood and it becomes hemorrhagic cyst. After 2 or 3 months down the line, it will regress and disappear. Most hemorrhagic cysts will disappear. Some will become permanent. They'll just be there and they won't cause any nuisance at all. So you leave them alone. They'll go away on their own. Doctor, does retroviral uterus affect baby getting pregnant? No. If you have a retroviral uterus, it doesn't cause infertility. A retroviral uterus means that your womb is not tilted to the front, it's tilted to the back. Okay? So most people, their womb is tilted to the front. Some few people, about 20% of people or less, their womb is tilted to the back. We call it retroviral uterus. So sometimes whenever they're constipated, they'll be in pain. Sometimes whenever they're having sex in a particular position, it can be painful or uncomfortable. But it does not cause infertility. Retroverted uterus does not cause infertility. I repeat, retroverted uterus does not cause infertility. Now, some people do have severe endometriosis and it has made their womb to be retroverted and stuck. For such people, except their endometriosis has damaged their tubes, they will still get pregnant. There was a lady we operated on in Kent a long time ago. Once we opened that lady, all her organs were stuck together. And this lady got pregnant some few months down the line. I wonder, how did this woman get pregnant? Everything is stuck together like frozen. It's amazing what God can do. It's amazing how nature can do things. Can hypothyroidism cause hypoprolactinemia? Thyroid gland, prolactin, they have some similarities and some interaction. It's possible, okay? But I can't say categorically. I'm not an endocrinologist. Doctor, I want to speak with you personally. So thank you, Christina, for speaking with Deborah. Deborah, if you want to speak with me personally, just follow the advice by Chinenye and by Christina they've given to you. Hello, everyone on Instagram. Thank you so much. And on YouTube, too, I want to say good evening to you. Thank you for watching us, for being here all the time. In Jide Kenya, on Instagram, talk to Saltoy, Precious62, Opoyamo Jesu. Thank you so much for joining us on Instagram here. Ye News Peel. Doctor, yeah, thank you. Abitu Atokwe. Saka Abosede. What can someone use for swollen tubes and get pregnant? If your tubes are swollen, that means that you have idiosarcins. That means that tube has been exposed to infection organism before, and that tube may sometimes be damaged or in problem. If your tubes are swollen, that means that tube is infected. The first thing is to treat the infection by taking swabs quickly and treating the specific infection, okay? Once we treat the tubes, in most cases, it's okay. But let me tell you something. If you keep on exposing your body to infections back and forth, the more infection, the more PID you have, the more consistent damage you're going to do to your tubes, and the more you risk having damaged blocked tubes. Infection 1, tube damage. You treat it, it will go away, but it will leave some residual damage in the tube. Infection 2 again, it damages the tube. It will be treated, but it will leave some residual damage. Infection 3, after a while, it becomes blocked. The more you have infection, the more you increase the risk of damage and blockage to your tube. Can someone with PCOS get pregnant? Yes and no too. Ogechi Eze, you want to talk with me privately? Just follow the link by Vivian and get things sorted. If you think you have swollen tubes, idiosarcins, damaged tubes, then first things first is to do HSG. Get HSG done to check that your tubes are not blocked. If your tubes are blocked, then they must be treated to relieve the damage there. Doctor, you have 2 days menstrual flow. Is it normal? It's too, I think it's scanty. But what I want you to do is to track how many days you're bleeding for during your period and track it for the next 3 cycles, and then let's talk, okay? How regular is your exercise? To exercise, you should do exercise at least 30 minutes exercise every day, ensuring you're sweating. Do that 3 times a week consistently, okay? All the time. 3 times a week, minimum 30 minutes, ensuring you're sweating. How can someone do to prevent smelly vagina? If you got smelly vagina, it's either you have an infection, get infection treated as soon as possible. Yeah, if you have a smelly vagina, it's either you're using some panty liners that you're allergic to, change your panty liners. Avoid wearing pants that are colored and use pants that are white. And if you have lots of vaginal discharge, then put panty liner in that area of your pants that covers your vagina to reduce it. Once in a while, when you're at home, don't wear pants. It helps hair to blow there and keep things fresh there. But if you got infection, treat them as soon as possible to reduce the risk of you having smelling VJ. What can be done to prevent ectopic pregnancy and heterotrophic pregnancy? Ectopic pregnancy means pregnancy in the tube. Heterotrophic pregnancy means pregnancy in the tube and in the womb at the same time. Pregnancy in the tube and in the womb at the same time. It is extremely rare. You probably see only 1 in about 10,000. So most doctors don't even see any in their lifetime. I've been privileged to see a lot. Heterotrophic pregnancy is extremely rare. It's common with people who are going IVF pregnancies. It's common with people that have had damaged tubes before. It's common in people that are going through artificial insemination. Yes. So if we do IVF and someone gets pregnant, the first things first is we do scan at around 6 weeks pregnancy to check that the pregnancy is not ectopic pregnancy. Okay, but how do you prevent ectopic pregnancy? Treat infection before they cause problem. You got infection, treat them appropriately. How do you prevent heterotrophic pregnancy? By preventing pregnancy on its own and get sterilized, or once you get pregnant, you do a scan to know you're pregnant, or don't go for IVF, which you should go for if you're trying to get pregnant, or if you have damaged tubes, get those tubes removed and then go for IVF. Okay, so there's really no hard and fast way to totally prevent heterotrophic pregnancy. Okay, but once we know that you are at risk of it, once you get pregnant, we scan you to pick it up on time and treat it as soon as possible. Temitayo Pretty Funny, how are you? And good evening and welcome once again to Ask Gynecologist on Instagram and on YouTube live. Thank you so much. So there's a question here. She says, Doctor, my question is, how do I know my ovulation period since I don't see any sign? My period is 30 days, period comes for more than 4 days. So basically, if your period is regular every 30 days, okay, that means on the 16th day of your cycle, you're probably ovulating. That's it. But I'll say, if you want to get pregnant, don't focus on ovulation alone. Focus on having regular sex, whether you're ovulating or not. The only time I would say don't have sex, if I would say, is during your period. That is if I would say. But some people do love sex during that period. It's up to them. I can't say what they should like. But to get pregnant, for the purposes of getting pregnant, getting sex during period can be a bit of a waste of time. But if you love it, fine. Now, apart from that, you can have sex all the time, regularly, every 2 to 3 days. In fact, 2 to 3 times a week regularly increases the chances of getting pregnant tremendously. So getting sex is very, very crucial. So about Shade Esther Adijare, you have a 30-day cycle on the 16th day of your period. That 16th day might not even be 16th day of the month. It could be any day of the month. But on the 16th day of your cycle, you should be ovulating. So you go and work with that, okay? But to get pregnant, don't focus only on your ovulation. Get regular sex. That's the most important thing. All right. Hello, Lady Empire. And Yenu Sports is asking a question here. Is it advisable for PCOS to do abortion? Is it advisable for PCOS patients to do abortion? I don't understand. My question is, why do you want to do abortion? I can't judge anyone from doing abortion or say you should not do abortion. But PCOS has got nothing to do with abortion. PCOS has got nothing, I repeat, it's got nothing to do with abortion. If you want to have abortion, you do it for what you want, but don't jumble PCOS into it, okay? At all, okay? Now, I'm not judging you. I don't know why you asked that question. It could be for you or for someone else. It doesn't matter, but I'm not judging you. Don't get me wrong. But what I'm saying is that PCOS has got nothing to do with abortion. If you want to do abortion for some reasons personal to you, that's fine. But PCOS has got nothing to do with it. Hello, Luabumi Ogunremi, and hello, Ayodele Dupe Abigail. Can PCOS have a negative effect on IVF? PCOS is the reason why some people go for IVF. So for you to go to have IVF, there are so many reasons. To block tubes, bad sperm, not ovulating at all. Sometimes PCOS, obviously, for example. So, but PCOS itself does not disturb IVF, but it could be a reason why you need the IVF in the first instance. Okay? All right, good. Doctor, I took letrozole. Follicular tracking you did. They grew, ruptured, you had sex, yet no pregnancy. Sometimes you take paracetamol for headache and it doesn't work. I repeat, sometimes you take paracetamol for headache and it does not work. Maybe it's the headache you're having is not because of headache, it's because of stress, depression, exhaustion, lack of rest, hunger. So, or anger. If you know what I mean. Anger. If you know. Anyway, or hunger is actually, anger can cause headache. So, because you have headache, doesn't mean paracetamol is the answer. You may have malaria. You may have typhoid. You may have poor eyesight or using the wrong glasses. So, because you've done Clomid, letrozole, you didn't get pregnant, that might not be the answer. It might mean you need a higher dose. It might mean you need a separate treatment plan entirely. So see your fertility consultant at our office and let us talk to you. Doctor, please, what are the ways of treating chronic infection? So, infection. So, when you come like such questions to me, I realize that you don't know what infections are. Or I think, I may be wrong, correct me. Infections can be caused by many things, okay? And there's no one drug to kill everything in medicine. So if you have an infection, for me to recommend a treatment, I need to know what is causing the infection. It could be gonorrhea, bacterial vaginosis, it could be chlamydia, it could be anything, or trichomoniasis. But I need to know what is causing your infection and what antibiotic is suitable, best suitable for such particular infection that you have. So I don't just say, you have an infection, take this, it will cure it all. I'm not an herbalist. I'm a doctor. I'm a scientist, first of all. So if I want to treat an infection, I need to know what is causing your infection. In your case, by doing vaginal swabs, by doing appropriate tests, checking your urine sample, examining you, do ultrasound scan to know what is causing your infection, then I can actually prescribe the best antibiotics suitable for that infection to effectively treat it and, if possible, cure it. And I'll also advise hygiene way habits to you to start with designing yourself around to reduce the risk of reinfection again. You've taken Clomid, regular sex, no way. You've done that with Proceed, okay. Let's move to IVF then. Call my office tomorrow morning. There's a bonanza still on. We are still doing the IVF promo for $850 and it's running till January 15th. But if you pay now, even if you have to do IVF in March, you have keyed the whole value. You have keyed the bonanza price. Many people are taking advantage. Many people. I won't tell you how many people came today, but they are taking advantage. Tomorrow is another day. Don't delay. Don't dull. And if you have any reason you want to, first of all, see a doctor to consult with, to know your options before you start your fertility journey, we have a doctor on ground, Dr. Chioma, very lovely lady. She will explain to you, go through your results. She'll get you organized for tests. You do some simple tests. She'll go to your result, and then she'll provide the best treatment plan for you to know if you need IVF indeed, or if you need if you need nothing else, or whatever you might need to get you pregnant. So you don't have to just jump in and pay IVF treatment immediately. You can sit down there, consult with Dr. Chioma. She'll go through your results, order some tests, scans, blah blah, then get you set up to know what is causing your infertility, and then we know what exactly we can do to treat, to sort your infertility out. Doctor, how fast is IUI for getting pregnant? Two more like IUI is simple. IUI is basically intrauterine insemination. IUI is done in IV as a technique to get you pregnant only and specifically, except on few exceptions, where the man has the problem, where the semen is the problem. At any point in time in your IVF journey or your pregnancy journey, if the man has problem and the woman has problem too, in most cases, with rare exceptions, you will need IVF. Juliet Edewo, please, Christina, let me answer Juliet Edewo quickly. Let me answer Juliet Edewo, please. If at any point in your pregnancy journey, a man has problem, okay, only is IUI, with rare exceptions. Maybe with ICSI, something like that. I said again, with rare exceptions. If at any point the woman has problem while the man has problem too, or they have problem together at the beginning, okay, it's going to be IVF, except in rare occasions, rare exceptions. So that's my blanket rule. So IUI does not get you fast pregnancy because it's magic. No. We give it, we use it only if it's absolutely necessary and it's the best option in your case. If it's the best option in your case, we don't just do it because it's cheaper. We don't just do it because you think it's okay for me. I want to choose what I want to get. I have a lot of ladies, okay, they come to ATG, they tell you they want to get pregnant. They've been trying for a year or 2 or 3 years. We tell them to do what they say, oh, no, doctor, I know what is wrong with me. I laugh immediately that this lady, I've been trying to get pregnant for 3 years. It's not worked. She sat down, agreed within herself that she needs to speak to an expert. You talk to me, I say, do this. Say, no, that's not what I need. Suddenly, it makes me to remember some stories in the Bible, okay? That some people, okay, they have problem. You tell them that this is the answer. They'll say, no, that's not what I need. And that story is about one man, I think they call something Naaman, one army guy from Syria that went to meet one prophet, Elijah or Elisha or something like that. See, this is the, for those who are not Christians, I'm not using this example, okay? This example too might have replica examples in the Quran too. I don't know, I'm not sure. But what I'm trying to say is that some people, they've been suffering from infertility. They come to me, I tell them, you might need to do this. Say, no, I won't do it. This is what I think is wrong with me. I say, okay, do it your way. They say, I like it that way. And they don't get pregnant. They get angry. I told you what to do. You say you don't want to do it. You want to do it your way. You see, whether you say this or say that, either way in life, you're always right. Life, in everything you do in life, the answer is always correct. You get what you put in. You sow what you reap what you sow. How long does it take for uterus to heal after hysteroscopy? In most cases, after about 3 or 4 weeks, but I would say give it 6 weeks, the womb will heal, okay? And once we've done hysteroscopy and we've done whatever we need to do, in most cases, it doesn't stop you from getting pregnant, okay? But if you're going to have what we call endometrial ablation, where we burn the lining of your womb from every period, okay, you can't get pregnant for the next 5 years until the womb regenerates. Adeyemo Bukola, my sister, how are you today? Aisha Maitata, Fabulous Niyot, Barbara Dianyi, how are you? Omowumi Oduwole, thank you so much. Thank you guys for watching today. I really appreciate you. I want to say God bless you. My name is Dr. J. I might not be online tomorrow because I'll be a bit busy tomorrow. But whenever I see you on Sunday, all things being equal, it's going to be a wonderful time. It's a seminar day. Our lecturers on Clomid Works. Don't miss that day. I want to see you there. It's my joy to see you there. And by God's grace, God willing, we'll meet each other there, talk about those things. The seminar group is totally different from this page. The seminar group is on Facebook, but it's a different page. Subscribe now, join it. It's free. The seminar is free. You don't need to pay anything. You just come on live on that day. The seminar is free of charge. Totally free. The seminar we did last month, and I think the month before, were totally free. I'm doing this thing for my heart. You see, the things we do here, ideally should be free. We should collect nothing, okay? But if we don't collect money, sometimes my phone is full of messages, 30 messages on WhatsApp. I have to answer women. I have to ensure that I give them comfort. I tell them what to do. We do these things free. But if we don't put a price tag, people will take us for granted. Other than that, everything we do here, I would love to do it free consistently, because freely we have been given, freely we can give. Even here at IVF Center, apart from the cost of consumables and drugs, which I cannot produce, every other thing we do it there, if you watch it well, is free. But we have to collect money for drugs because I can't produce drugs. I can't produce the IVF consumables, all those mineral oil, the eating blocks. I can't. I have to pay them to our suppliers. So that's the way it is. So, but other things you pay for. Everything we do here, we want it to be free. We want to keep it so. Our seminars are free. Join today and be there on Sunday. God bless you and have a wonderful weekend ahead. I want to say once again to you, listen to me attentively, and I say these things without joking, and I mark and I choose my words properly well. Everyone to everyone listening to me tonight, I want to say happy Thanksgiving if you're in America, and I want to say to you, I love you all. To each and everybody listening to me today, I want to say I love you all. I respect you, I love you, and God bless you. I hope to see you soon. And most importantly too, I love myself. Thank you once again, and see you. Bye-bye.